Did you know that for couples that are struggling to conceive, up to 50% of the time, there is a male factor component? Today, you're going to learn all about natural tips to improve male factor fertility and sperm parameters. I have so much information to unpack. I have to actually do this in two parts. This is part one, and it's step 1 through 5 on these wonderful tips. And you can look for part two to look for steps 6 through 10. Now, let's get started. I'm Dr. Laura Shaheen. I'm a double board certified OBGYN and reproductive endocrinologist, helping people build their families and people who are struggling with male factor fertility for over 20 years. And I love educating. If this is your first time to this channel, welcome. Be sure and subscribe so you get my weekly videos all about reproductive health. Two other ways to stay in touch. Number one is my podcast, the Baby Robust Fertility Podcast, out with weekly interviews and in-depth discussions on all things reproductive health. And number two, my weekly newsletter, where I send you information on fertility and the news, top tips, content for that week, and products and books that I recommend. Male factor fertility is finally getting the attention that it needs. For far too long, we have been so laser focused on the female part of the equation, or the person with uterus and ovaries, being the only issue when it comes to fertility, and that is just not the case. Sperm, or male factor fertility, is 50% of the genetic equation, and it is so important that we pay attention. Improving overall health for the guys with sperm is going to only improve reproductive health and fast track for fertility. Now, I have so many lifestyle tips to share. I've got 10 to focus on, and it's so much information. I had to do this in a two-part series. This is part one, and we're going to focus on the first 5 tips I want to discuss, and make sure and look for part two, another video where we go over the second 5 for a total of 10. Now, today we are going to cover 5 topics and 5 ways that men can improve their sperm parameters and their fertility naturally. Topic number 1, diet and nutrition. Topic number 2, exercise and moving your body to improve health. Topic number 3, maintaining a healthy weight. Being underweight or overweight can impact sperm parameters. Topic number 4, stress and fertility in men. And finally, topic number 5, the importance of sleep for male factor fertility. Now let's get started. Topic number 1, nutrition and diet to improve male factor fertility. Now, the research on this is all over the place, but it does make sense that the healthier nutrition that we eat, the better our reproductive health is going to be. There is an excellent review article from the Journal of Andrology looking at all of the studies that had come up before that study was published, looking at the different types of diets, the different types of foods, and the research surrounding what to recommend for men who are trying to improve their fertility. In this review article, they categorize different studies into 3 main types of studies. First type is the type of diet. They look at Western diet versus Mediterranean diet versus keto, and they try to explain which diet is best for fertility. Second type of study is looking at large food groups and how these can change and interact with male fertility, meaning like more or less dairy, more or less vegetables, more or less red meat. And they kind of go through each of those studies. And then finally, the third type of study that they analyze is certain nutrients found in foods, looking for foods high in antioxidants, like could that be helpful? Maybe high in zinc or selenium. Really, really helpful tips looking at individualized nutrients that could be beneficial for sperm parameters and male fertility. Honestly, the research shows what we really already know. The healthier you eat, the better your nutrition, the better your fertility is going to be, especially for men and sperm. So a diet higher in fresh fruits and vegetables, higher in less processed foods, and a higher protein diet but less red meat can really be associated with better male fertility. Some key tips that were shared in the overall studies and kind of combining them and looking them all together. So if you're looking for a type of diet to follow or a recipe book to follow and look for kind of an overall diet that's best for male factor fertility, the one that comes up over and over again is a Mediterranean diet. Mediterranean diet is high in fresh fruits and vegetables, whole grains, and lots of protein, but less red meat, more chicken and fish. This is much better for male fertility compared to a Western diet, which is usually categorized with a lot of red meat, a lot of processed foods, a lot of fried foods. And so less of that and more of a Mediterranean diet is going to be helpful for your overall male factor fertility. A diet high in trans fats has been shown to decrease male factor fertility and sperm parameters by almost 20%. Trans fats are formed in an industrial process in which a hydrogen is added to vegetable oil. It turns the oil into a more solid form at room temperature, and it is used to increase the shelf life of packaged foods. So some examples of foods that have a lot of trans fats can be commercial baked goods like cakes and cookies that are individually wrapped and kind of buy at the grocery store. A lot of fast food, fried food is cooked with trans fats. And then stick margarine or shortening, often used in cooking, that can be full of trans fats. So trying to avoid these or having less of these in your diet is going to help you improve your fertility. As far as looking at key nutrients, especially in foods that can improve sperm parameters and male factor fertility, there's really three areas that have the most evidence to support it. That's looking for foods that are high in zinc, folate, and antioxidants. Zinc, folate, and antioxidants have been shown to improve sperm parameters. If you think about it, sperm is being made every single day. That's a lot of cell turnover. It's a lot of reading DNA. And if you can do that process in an environment where there's less free radicals and less oxidative stress, you're going to have better DNA replication and probably healthier sperm. And antioxidants, folate and zinc, have been shown to decrease free radicals and that oxidative stress. That's the reason that they think that sperm parameters are improved. Zinc can be found in oysters, beef, and beans. Folate can be found in leafy green vegetables, legumes, and some fortified cereals. And antioxidants can be found in foods that have a lot of vitamin C, vitamin E, such as oranges, nuts, and seeds. So to recap, nutrients, nutrition, extremely important for male reproductive health. If you're going to choose a diet, focus on a Mediterranean diet. You're looking for more fresh fruits and vegetables, less red meat, less processed foods. You want to decrease trans fats in your diet, avoiding fast food. I mean, every once in a while, enjoy fast food, but just not a routine part of your diet. Having less of the commercial baked goods, and then trying to increase foods in your diet that have a lot of zinc, antioxidants, and folate. Topic number 2, exercise, moving your body. Exercise is so important. It helps decrease your stress. It helps you sleep. It helps your metabolism. But exercise is sort of the Goldilocks of recommendations when it comes to male factor fertility. You don't want to do too little exercise, but you don't want to do too much exercise either. You want to be right in the middle. There's a wonderful article that came out in 2023 from the World Men's Health Journal, and it went through and summarized a lot of the amazing research looking at exercise in men's health, specifically men's fertility. The authors recognized that the research is all over the place, and it's hard to find strict guidelines for each individual person, but they did see trends that they wanted to report. They have this nice little graph here that's talking about physical activity, the type, and the intensity. And it's basically showing that really, really high intensity training, high intensity levels of stress hormones, actually going to be stressful on your reproductive system and decrease sperm parameters. But low and intermediate regular exercise and moving your body can actually really be helpful for sperm production and your overall male factor fertility. They specifically found that very heavy weightlifting and very intense exercise and training regimens were poor for sperm parameters. But again, moderate exercise was associated with ideal hormone levels, including testosterone, decreased DNA fragmentation, and overall better sperm parameters. When patients hear this, or you hear me talking about this, you say, well, that's great, but what is intense and what is moderate? Like, I need details. Tell me what to do. And I really understand that. It's hard to individualize the research to each individual person. They share one study that gave one very strict guideline saying that if someone bikes more than 5 hours per week, that can be associated with poor sperm parameters. Another study showed no difference in the type of exercise, like running, racket sports, cycling, but that heavy competitive weightlifting was associated with lower sperm parameters. So how do I talk to my patients about it? Listen, I say, I want you to move your body. I think it helps in so many aspects of our health, including our reproductive health. This is not the time to train for an Ironman if you've never done this before, or a marathon if you've never done this before, but moving your body is really important. I think of moderate exercise about 3 or 4 times a week would be perfect. And you got to find what's right for you. Lifting is wonderful. It's just trying to get to those really, really, really heavy weights or making it a competitive thing that seems to impact sperm production. And running is great. Cycling is great, but maybe just not too much, not over 5 hours for the cycling piece. So moderate, moving your body, but just not to extremes. That is the best recommendation. Now, talk to your doctor about what's right for you. Topic number 3, maintaining a healthy weight. Listen, people can be fertile at many different body sizes, but there is evidence that being significantly overweight and significantly underweight can impact male factor fertility. Obesity can be associated with many different poor male fertility parameters. An excellent study published in Fertility and Sterility, which is the Journal of the American Society of Reproductive Medicine, really went through the risks in great detail. It's an excellent study. In this study, they show this image talking about how many different aspects of being overweight can impact male factor fertility. Everything from epigenetics, like DNA methylation can be altered, DNA damage and DNA fragmentation can be changed when there is significant obesity. Hormonal changes associated with obesity, having higher estrogen levels, lower testosterone levels, really can change sex binding hormones and function of hormones throughout the body. And other things, being obese impacts cardiovascular disease, increased hypertension, chronic stress, difficulty with sleep. All of these factors can impact male factor fertility and sperm parameters. And the authors conclude, evidence strongly suggests that both obesity and metabolic disorders, such as diabetes and metabolic syndrome, have a negative impact on various parameters of male fertility, from semen quality to sperm DNA integrity, and even ART, or that means assisted reproductive technology, or IVF outcomes. However, lifestyle interventions such as physical exercise generally appear to improve male fertility markers, although the type and intensity of exercise may play a crucial role. So they are summarizing that previous study that went through a lot of other studies, how there are specific exercises and intensity level that can actually be too much or too little. You want to be just in the middle. I want to make sure you realize, though, that being underweight can also impact male fertility and overall health and well-being. Being in a state of energy deficiency basically makes us feel like we're in fight or flight mode, and our body gets shifted away from focusing on reproduction to trying to just survive on a calorie deficit or an energy deficit. There's an excellent review article from the Journal in Metabolism, and it goes through the hormonal impact in detail of being underweight in both men and women and how it impacts their fertility. So again, people can be fertile and happy and healthy in many different sized bodies, but there is a goal for moderation, not being too overweight and not being too underweight. And I hope that this is helpful. Topic number 4, stress and male factor fertility. This is a tough topic because stress can feel subjective, and you could start stressing about being too stressed and just struggling to have a family when you are ready and are ready to be a parent can be stressful in and of itself. So is it that the stress is causing the infertility, or is it the infertility that's causing the stress? Is it the chicken or the egg? And it's just everything in between. But it is important to pay attention to stress, because putting yourself in a stressful state or not managing it really can impact so many different aspects of our health, including male factor fertility. A great cross-sectional study of almost 200 men published in the journal Fertility and Sterility, called The Effects of Work and Life Stress on Semen Quality, really reviews this impact in detail. both perceived life stress, meaning that men were filling out questionnaires and talking about how stressed they felt in their everyday life, plus two or more documented life stress events, such as a death of a family member, job loss, personal injury, or illness. Both of those things, whether it's a life event or perceived stress, both had an impact on male fertility and sperm parameters. So it doesn't matter which comes first. And I don't want people to stress about being stressed. What I guide my patients is we've got to learn how to manage stress. We've got to learn how to find joy in life. Because if you just ignore it or you try to push through, it's not going to get better. So finding things to find joy, find happiness, work with a therapist, do exercise, journal, whatever it is that helps decrease your everyday stress and helps you find joy is going to really help your overall health and well-being and only improve your male factor fertility. I do have another video here on YouTube called Stress and Fertility, where I go into some very detailed recommendations on how to help find resources for you to decrease your stress. The last topic I want to talk about is something to avoid. So we've been talking about nutrition and exercise and stress and ways to improve male factor fertility. This topic is what to avoid: tobacco and alcohol. If you want to improve your male factor fertility, no smoking, no vaping, and really limit alcohol. Smoking and vaping in particular results in poor sperm parameters, higher DNA fragmentation, longer time to conception, and increased risk of miscarriage. A wonderful committee opinion from the American Society of Reproductive Medicine, which I'll show you here, really emphasizes the research and the evidence surrounding how you should not be smoking or vaping when you are trying to conceive. It concludes that smoking impacts male reproductive hormones, really decreases testosterone. Sperm parameters are worse in smokers, and smoking decreases the success with fertility treatments such as IVF. And smokers require an average double the number of treatments like IVF cycles in order to conceive and have a baby. Absolute recommendation is to stop smoking, stop vaping. Another topic to really consider limiting at a minimum is alcohol. I know alcohol is a part of our social fabric. It's how we enjoy dinners out with friends. It's how we celebrate with a glass of champagne. But regular heavy alcohol use can disrupt many parts of our health. It can change our metabolism. It can change our sleep. And it has been associated with infertility and poor male factor fertility in particular. One large study published in an excellent journal, Human Reproduction, looked at self-reported alcohol use in men who were trying to conceive and said, in particular, more than 6 servings of alcohol in a week were associated with a longer time to conception, a higher chance of infertility, and the recommendation is to really modify. So the 6 servings of alcohol per week, that's what that particular study showed. I think everybody's body is a little bit different. That might actually be too much for a lot of people because alcohol affects people differently. What I tell my patients is that I do not think alcohol should be a part of our everyday life, and that if we are celebrating, out to dinner, enjoying time with friends, just have a little bit, like a glass or 2 at the most. Binge drinking is also really not recommended. It is so hard for our body to process, disrupts sleep, disrupts metabolism. And so a really special occasion, but really try to limit alcohol intake to improve your male factor fertility. So to recap, we've gone over 5 natural ways to improve male factor fertility. First, we went through nutrition and diet. We looked at overall diets and nutrients that you can increase in your diet to improve fertility. We went over exercise and activity level, not too much and not too little. We went over the importance of a healthy weight, not being too overweight and not being too underweight as a way to improve fertility. Number 4, we went over stress in men and how it can impact male fertility and sperm parameters and tips to improve it. And then finally, we went through 2 things that you could really limit or completely quit: tobacco and vaping, and then alcohol use as a way to modify a lifestyle choice in order to improve male factor fertility. So this is just the beginning. I hope these 5 tips are helpful. Tune in to part 2 for 5 more tips to improve male fertility naturally. I hope you learned something today. Like this video if you learned something. Comment with questions that you have. Be sure and subscribe to this channel so you get my weekly video all about reproductive health. And until next week, wishing you love, luck, and pineapples.